This is Adam Tucker, and welcome to this month, September's CFC Council meeting. Thank you, everybody, for joining us today. Before we get started, I want to let everybody know that we are recording today so that we have record and we can share this with folks that were not able to join us today. So with that, next slide, please. So just really quickly, kind of just our normal kind of startup here. These are our HICBOT CFC team members. And then we also have an expert on the PCBA, which we're going to discuss today, and that is Christy. Christy is also on here, and she will be helping us out today. So next slide, please. As everybody knows, our mission: improve healthcare access and outcomes for people who serve while saving Coloradans money on health care driving value for Colorado. Next slide, please. All right, so today, guys, what we are going to kind of go through, and this has actually been requested a few times, but really actually looking at the specific IDD waivers and the DD waiver and the SLS waiver. And then part of that kind of larger conversation is this person-centered budget algorithm and how that's going to interact with CFC. And then we'll go right into open forum. So that is our agenda for today. Next slide, please. Again, as we kind of always bug you guys about, attendance is really, really a big deal for us. Making sure that we know who we're talking to, who we're hearing from, different things like that is really important. So Eileen, I believe, is going to throw the attendance link in the chat. So if everybody could just hop on there really quick, it only takes a couple of seconds. And then the other thing is, if for whatever reason we can't get that, or there is you weren't able to access it, you can always just give me a call, 303-866-5472, and then we can kind of make sure that we have you that you were here, but also if you just wanted to talk about other stuff, we can also do that at the same time. So next slide, please. So especially since we are recording today, we do ask that you don't share protected health information, mind your e-manners, stay solution focused, respect others' time in the meeting time. Also, guys, if you ever need a reasonable accommodation, such as translation or anything else, please reach out to John Barry. His email is john.r.barry@state.co.us, or you can call him at 303-866-3173. This also goes for anybody that may not be joining us, and maybe the reason why they're not joining us is because they don't know how to ask for some of these accommodations. So please let us know if you know of folks who are in that situation, so that we can better support them. So next slide, please. All right, just as a friendly reminder, this is how CFC is looking, and this I think will make a lot more sense as we start to look at the DD waiver and then we look at the SLS waiver. And just remember that we have a lot of services that are in that HCBS top of that pyramid. And then what we're doing through CFC is we're kind of removing a lot of those services, those services that really support people with their daily needs, so showering, all of those kind of things. We call those ADLs and IADLs. We're moving those out and we're moving them down more into the state plan, which gives a lot more flexibility. So hopefully after today, some of this will be better understood and not just seen as kind of in this pyramid. So next slide, please. All right, so when we're thinking about specifically IDD, the waivers, the DD comp waiver or the DD waiver is what it's officially called, developmental disability waiver, or the supported living services waiver, which we call the SLS waiver. So I will try to use their full names as we're going through, but every once in a while, as you guys can tell, I might slip up because I'm used to calling these by their acronyms. So the first one we're going to hit is the developmental disability waiver. Next slide, please. One of the big things that as we're discussing this is that because we're taking those services like personal care, homemaker, those types of services, and we're moving them out of the waivers and we're dropping them down into the state plan. If you guys go and you look at the DD waiver right now, you'll notice that those CFC services are not standalone services. They exist on the DD waiver, but they are encapsulated, or what we call bundled, into a single rate that is a residential service. So that group residential supports and services, or the individual residential supports and services, all of those things, they encapsulate CFC services. They just do it inside the residential bucket. One of the big things that we always, as administrators of Medicaid, administrators of home community-based services, we always have to make sure that we don't duplicate services. What that means is that we don't want, or we can't have someone getting services from multiple different kind of buckets within Medicaid. We need somebody to get their services from one bucket, and then if that bucket doesn't have that service or cannot cover that need, then we start to look at those other buckets. The thing with the DD waiver, when we're thinking about CFC, is that all of the CFC services are already contained in the DD waiver, and because they're rolled up and because they're designed to be rolled up, we're not going to mess with that. We're not going to break that up or change that. So most people who are on the DD waiver will, all of them will have access to CFC, but it's only if they have that assessed need. And that assessed need is not going to be things like personal care or homemaker or anything like that, because that's already dealt with within this other bucket. There'll still be some minor services that if somebody really shows a need for that through the assessment tool, which we're going to talk about later, then we can really dig into that. But the majority of the time, somebody who is going to be in a residential service, that residential service is going to cover all of those CFC services, but they're going to cover them in that bundled type of way, which just makes it easier for certain individuals with kind of what's happening with them and the needs that they have that need to be met. So that's kind of encapsulates the DD waiver in the way to think about it. So remember, we cannot duplicate services. The DD waiver has a residential service component within it that encapsulates most, if not all, of the CFC services. And so if someone, or if a member chooses to go into the DD waiver, they're going to get those services through that mechanism. So let's move on to the SLS waiver. Any questions on that so far? Anything like that?
I have a question, Adam.
Please.
If the client is not in residential setting, at least over here on the western slope, they don't necessarily have some of those services. And so they're currently not available under the DD waiver because we don't have a provider for them for like homemaker, those types of services. So if they're not in the residential, how do they then get those?
So Cheryl, if they're on the DD waiver, there should be, are there residential providers? Let me just ask that question first before I dig into it.
Yes, well, we have group homes and we have those types of settings, but not everybody's in those. Some people live at home.
Right. Well, and so in those situations, if they're on the DD waiver, Cheryl, so if they're on the DD waiver, even if they're living at home with their parents, they're still being covered underneath that residential service. For folks who are not in that residential service, they are going to be on the SLS, or supported living services waiver, which will open them up to accessing CFC and IHSS and CDOS, and that's what we're going to hit next. Does that make sense, Cheryl? Am I answering your question?
Yep, you sure did.
Awesome. Thank you. Yeah. Okay. All right. Next slide, please. Oh, Julie, go for it.
Sorry, I put this in the chat. I meant to say, why is transition set up under both areas? Did I miss that? Because you were talking about duplication and then it's under both.
So yeah, Julie, so this is where it does start to get really confusing. And this is where I was kind of hedging when I was talking about the mass majority won't, because home delivered meals and transition setup really should be covered under that residential service. There have been a couple of really rare incidences, and that's why we still have home delivered meals and transition set up in the DD waiver. But those are so that people can access them as they're transitioning. However, that's rarely, you have to prove that it's not being duplicated over here. So the mass majority of people are not going to be able to even access those. It's just that we kind of have them there for those really, really outside the norm kinds of situations where we really need to help somebody with those two things. Does that help, Julie? Cool. But no, Julie, you are right on with those are 99.9% of the time those are duplicative home delivered meals and transition setup. So yes. Okay, so SLS waiver is a little bit more because it doesn't have that residential component, and because those ADL and IADL supports like personal care, homemaker, health maintenance, all of those types of services, personal emergency response system, or what we call PERS, all of those types of things are already broken out as individual services under CFC. So what's going to happen when we move into CFC and we bring CFC live is exactly what we're talking about in the pyramid. So lay the SLS, this slide on that top of that pyramid, and we are going to slide out those CFC services. So personal care, health maintenance, homemaker, medication reminders, personal emergency response, home delivered meals, all of those services that will be moving over to CFC. Someone on the SLS waiver will be receiving those CFC services through CFC, while other things like day hab and supportive employment and a lot of those other kinds of services, those will still be in the SLS waiver, and someone will be able to access them through that. So they'll be working together, while kind of from an administrative standpoint, kind of be sitting in two different buckets. But the goal is that they're still working together, if that makes sense. The really cool thing, though, is now all of a sudden SLS members will have access to IHSS. So not only will they have access to CDOS, which they have now, but we're also going to expand this into another option, which is in-home supports and services, or IHSS. So again, when we're talking about the SLS waiver, we cannot duplicate services. That's why you're seeing us pull those services out and just move them into that different bucket. It's all in an attempt so that we can make sure that these are as clean and as clear as people, so people can better understand them, while also making sure that people can use them and make sure that if they do need to interact and they do need to overlap, that can still take place, just like it does in the waiver now. Any questions on SLS stuff? We're going to get into the SPAL stuff and all of that kind of stuff next, but from a service standpoint, does this make sense from the SLS perspective? Cool. So Megan, everybody, Megan just asked, will this impact waiver budgets? We are gonna hop into that right now after we get done talking about that. So Megan, just hold on like one or two more slides and we'll dive into waiver budgets. All right, cool. Okay, next slide. And next slide. All right, so part of kind of the revamping of all of this, and this isn't because of CFC. This is actually with person-centered budget algorithm and the process that is being developed, being implemented around the PCBA is what we call it, and the universal assessment tool. This was not caused because of CFC. This was actually coming out of Senate Bill 16192, which was a bill to replace the SIS, or the support intensity scale, which is currently used in the IDD waivers to support where somebody's budget tier is, or kind of what support level that they're at. There was a big movement to get rid of the SIS in the state of Colorado. A piece of legislation passed, and so we were instructed that we need to change it. So when we did that, what we were really shooting for is making sure that that it was universal, that we're expanding it just beyond the IDD waivers, but that it becomes more universal, and that, sorry, I'm also looking for some talking points, so give me one sec, guys. I just had them up. Anyway, so so really we're looking at the PCBA as a way to kind of standardize across all waivers and populations. The nice thing about the PCBA is it really is based on that person-centered budget algorithm. It's that providing that consistent method of evaluating budgets and kind of where people are at. And then within this, we're also developing those additional exemptions and exceptions process to make sure that everybody has the ability to get the services that they need in the place and time that they need them. So the PCBA really is set up this way. We're going to get into some flow charts because I think that as we're talking about the PCBA, it's also really important to think about process, right? So this will make sense in a couple of slides, but I'm going to throw this out so we can start to think about it and put it into the conversation. Really think about the person-centered planning process, or that entire process as you have the assessment, you then do the person-centered planning process. After that person-centered planning process, which the case manager and the member are using that assessment so they know kind of what intensity somebody needs, how much service that they need, those kinds of things. You're gonna work on that. Once that person-centered plan is done, that's when it's compared to the PCBA. And so remember, the PCBA is kind of after, it's a kind of a final check to make sure things are lined up for people. So next slide, please. So one of the really cool benefits is that this is a really transparent, objective kind of process. It's really focused on making sure people are getting the right services in the right amounts. And it's really based upon really what kind of the universal, what everybody is using. So we look at live data as this PCBA is kind of being brought forward and being alive, so that we have a better understanding of what people's needs are, what costs are, different things like that. The other thing that this process, and not just the PCBA does, but it also really allows people much more flexibility around what services they want to choose, how they want to use them, where they want to use them. The whole idea behind this new kind of universal process really is to give more flexibility. And then CFC is another kind of a weird little curveball within all of this. So next slide, please. Like I was saying, so this is where we're going to start getting into that process. The PCBA is running in that background. And so what we're doing is we're looking at the Colorado Single Assessment Tool. That's what CSA stands for, Colorado Single Assessment Tool. This will include the level of care. This includes the needs assessment. It's going to be done to all members. All members will have the opportunity to go through this. And then that goes into the person-centered planning. And then from there, that's when the PCBA will be used just as a final check. Megan, yes, this is for children and adults. And before I go any further, Kelly, also, did you find that the SIS didn't work well for some beneficiaries, such as those with autism? Kelly, I can't really actually answer that question. I do remember when the debate was going on, and I know that the SIS and the change in the SIS really was a push from advocates. And so we supported it, but it really was a huge push from advocates. And so I'm not privy to all the details of why there was such a push for it. So I can't really answer that. We could probably find some information, but yeah, sorry, Kelly. All right. So the other thing is all members, regardless of their waiver, is going to be using this. So this is not just for the IDD waivers. We are using this opportunity to expand it to all of the waivers. We also will never use the PCBA as a way to determine if somebody gets a CFC service or not. Again, this is kind of a check at the back end, and we'll get into that process here in just a second. Next slide, please. All right, guys, so this is this flow chart. And really what we're talking about here. So we have the case manager really from the very, very far right, that top, what is that, a hexagon? Case manager and member complete the single assessment, so that universal assessment. That's the level of care, that is the needs assessment, that's all of those pieces. That is all completed. Then that information on one path just gets transferred over to the PCBA. And then the other path is when the member, the IDD, the interdisciplinary team, and the case manager start to work on using that assessment, because that assessment will say, you know, this person really needs support with showering. This person really needs support with being in the community. They need help with social interactions. They need those different types of things. And so what's going to happen from there is the IDT and the member will start to do the person-centered planning process around that, identifying what goals, identifying what kind of supports are needed for that person so that they have an opportunity to go live in the community, to go and achieve their goals. All of that gets sorted out, and all of that person-centered planning gets done. And then once that's done, it gets sent out to the member's person support plan. And you can see now we're on this very, very far left edge. So we have the PCBA tier and the member person-centered support plan. You can see that line right there kind of coming together, and then there's that line going off the page. So remember that as we go into the next slide. Next slide, please. So this is where we are. So the member support plan is compared to the PCBA. If that support plan and this PCBA is going to be using historical data, including ongoing data, to make sure that it fully understands these different budget tiers. But if a member sets up their person-centered plan, it fits in with the PCBA kind of budget tiers, that last check, everything's kosher, everything moves forward, and then the services are authorized. If we go through this process and it is found that something doesn't fit with the PCBA tier, that's not a rejection of the person-centered support plan. What it does is it sparks a process for us so that we can go and we can make sure that things are lined up. This isn't going to be one of those where, you know, hey, we're coming in and we're saying, nope, you can't do this. You have to reduce, especially with CFC. CFC budgets are based on needs. So as we go through it, the exceptions process will look at, are there still ways to bring them back underneath, because we want to understand why somebody isn't meeting that PCBA tier. If they show that, hey, we don't meet that PCBA tier, but I need this stuff, and here's everything that's showing that I need it, we will approve it, and it will get pushed into service authorization. Okay, that was a lot to explain. So I'm going to take a breath, and I'm going to read Catherine Carroll's a question, and then we'll open it up for bigger questions. So Catherine asked, still trying to understand the universal algorithm and person-centered service work together. I understand we have to deliver services to a large number of people, and customizing supports can be challenging in that environment. Catherine, I totally hear you. And I think that one of the things that we really were working on around this was that, so the universal algorithm is going to look at kind of historic data, service data, and really kind of set those PCBA tiers up that way. Christy or Martin or anybody, do you guys have anything to maybe add to this that could be helpful for Catherine?
Hey, Catherine, this is Christy Blickman. I'm the PCBA coordinator, and I'll also defer to Martin to supplement my answer. He can give some information on how the PCBA, the data analysis is conducted, but I did want to just emphasize that the order of operations, I think, with the person-centered service planning coming first and really taking a look at the support needs on the front end, and then having the budget tier on the back end puts the order of operations in a person-centered manner, so that we are really looking at support needs, and that's determining where they will fall in terms of the PCBA budget tier. The PCBA budget tier dollar amounts, I believe there's going to be a range, so it's not going to be just like a set dollar amount per budget tier, and we will have those budget tiers 1 through 6 And those dollar ranges will allow for some flexibility. And of course, if somebody, for some reason, the support needs exceed that budget tier amount, we absolutely will be working with stakeholders on an exceptions process to ensure that we can use that for members who don't fall within the identified PCBA budget tier range. And this will be largely modeled after the existing SIS support level review process with modifications based on the lessons learned from the current process. So we will be working with stakeholders on that. Martin, did you want to supplement a bit more on her question around the universal algorithm and maybe how that is being, it's not developed yet, but what kind of data analysis you're working on to ensure that it's meeting those support needs to the best of our ability?
Sure. Yeah. So we'll be using a sample from across the whole population of people who receive HCBS services. So we want to make sure it's comprehensive in that regard, and also the like Christy was talking about, it is in the order of operations. It does come after the person-centered support plan, and really it'll help to make sure that things aren't missed. So, for example, if the person has a need that just wasn't caught as part of the person-centered support plan, the hope is that the PCBA will come in and point that out, that they might need more services. Alternatively, it might also point out that they might be able to live in a less restrictive setting. And so really, it's just about making sure that there is some objective idea coming in here. And like Christy was talking about, it's set in ranges, so it is not meant to say that any given number is right for any given person. It just wants to make sure that you aren't missing things, high or low.
Thank you,
Martin. And sorry, Adam, I should have introduced Martin. Martin, sorry, I have a puppy. I apologize. She's a little wild this morning, so I'm so sorry for the background noise. Martin is with Optimus, which is the PCBA vendor working on developing the algorithm.
Awesome. Thank you, Christy. And I have not heard your puppy once, so no worries.
Good.
All right. So Megan, I think the one in the chat is next. And then did I also see some folks had their hand raised, and I will get to them. So Megan, your question is, so there will now be a member budget that includes things outside of waivers like home health. How does EPSDT fit into this? So Christy, do you have any language on that?
I apologize. I do not. However, I will provide my email address in the chat, and you're welcome to send me questions in writing. And I am happy to get back to you as soon as possible with more information on your proposed questions.
Awesome. Thank you. I do know that, Megan, like EPSDT fits outside of some of these processes. So it does start to get a little bit more nuanced and different things like that when we start talking about home health. So yes, we will bring that back. Make sure that we have our ducks in a row before, so we're not giving you information that doesn't make any sense. And we will, I'll make sure that we have a slide about that next month so we can talk through it. And as always, Megan, you always have great questions. So thank you. And then did we have anybody's hand raised? I thought we saw some folks. The special needs.
Hi, Adam. It's Michelle Morris.
Hey, Michelle.
Hey, honestly, I raised my hand because I have so many questions, but listening to other people's questions and answers, I'm not even really sure where to start. So I think the best way for me to start would be coming from a perspective of the children's HCBS waiver. This is all very new, but it obviously sounds like this is the direction we're going in. So I guess the easiest thing for me to ask, will there be specific training for the case managers on the PCBA and how all of that falls into place as far as their service plan and their budgeting, and if it's outside of services? And then kind of tagging on what Megan's question is, you know, what area does that fall under waiver, CFC, so on and so forth? Because for children's HCBS, we don't use the SIS or the support intensity scale. So, I mean, this is all, you might as well be speaking German to me. Just, throw me a stein of beer at the same time, if you will.
Totally. No, I totally get that. And Michelle, I think one thing that you may want to do, we could do a couple different ways. I think we could maybe have a side conversation. We could kind of catch you up. But to your actual answer, yes, there is extensive training being designed and planned for case management around this. It's going to be embedded as part of the person-centered planning process training. It's all going to be very much supporting case managers and learning how to do this and how to do this well. And kind of the hope is that with case managers learning the assessment tool, learning the level of care, and then also learning, how to utilize that within the person-centered planning process, that we're also going to see just a better universal process as a whole, and that the PCBA kind of back end part only pops up in really weird, extraordinary cases. I can't guarantee that that's going to happen, but that's really why we want to do the order of operation the way we're doing it. So we're thinking level of care, we're thinking needs assessment, doesn't need to be the CIS. We're using that into the person-centered planning process and kind of moving from there. I think also too, for anybody who really finds this stuff really interesting and really wants to dig into it, the department is going to be working with stakeholders to develop different parts of the PCBA process still, including to identify PCA budget tiers, an exceptions process, all of those kinds of things. And so, we're going to have ongoing stakeholder meetings. The next support plan working session is scheduled for Thursday, September 28th at 12:30 to 3 p.m. I'm going to kick it over to Christy to talk a little bit more about that once we get through these questions. Unless, Christy, you want to just hop in now. I saw your hand up.
Sure. So I was just going to say, for that assessment and support plan working session, that includes all things CCM system. And so we are going to start reintroducing the topic of the PCBA at this next meeting. However, there will be a lot of there's the puppy. There will be a lot of agenda items that we'll cover related to the CSA, the CCM system as a whole. And so we'll touch on the PCBA, and then each session after that, we'll get a little bit more in detail and work with stakeholders on critical variables, the exceptions process, budget tiers, etc. So if you do want to join those meetings, feel free to send me an email. My email's in the chat, and I can get you added to those invites.
Awesome. Thank you so much, Christy. Donald?
Yeah, great. Thank you. I kind of have two questions, and I think they semi got answered. But I'll just ask them anyway. So how do you determine what tier everybody's on the PCBA? I heard them mention statistical analysis and analyzing a sample from everybody on HCBS, but everybody on HCBS, their needs are, completely a wide variety. So how do you determine that tier? And it sounds like you're still working on defining that. And then also, your person-centered support plan, I think it sounds like the big conduit is still the case manager and determining a lot of that. Currently, just my understanding and people that I talk with, that the case manager still is a it's an area of hard communication sometimes, a lot of misunderstanding on needs. I heard somebody say it's like going to a restaurant and not getting a menu and having your server ask, well, what do you want to eat? So I think this is neat, but I just have concerns that we're going to run into the same problems. So I would really encourage, I know you said strong case management support and case management education, but I could still see some of the same problems that we're currently having. So that's just my, recommendation and question.
Awesome. Thank you, Donald. And Michelle, I totally agree, Donald. That was a really good analogy. So one of the things that's also occurring right now is that and then I'm going to kick it over to Martin and Christy to kind of talk about to kind of discuss a little bit more about how the PCBA is being developed. But I also want to just mention that while this whole process, one of the things that we're looking at in the next few years is some significant and major rehaul of our system, including the case management system. And part of the PCBA, part of the new universal assessment tool, all of that, the new care and case management computer system that case manager being trained on now, the revamp around case management of combining both the single entry points and the community center boards, all of that work is really to reinvent the case management system in a way that is more person-centered. Case managers will have better access to information. They'll have better access to training that will lead the goal is that will lead to better person-centered planning processes, those different types of things. One of the things I'm also excited about from a PCBA perspective is that it also allow us to kind of identify some of those hot spots in the state where maybe assessments aren't being done very well because there's lots of people that are outside their PCBA tier. These are tools that we'll also be able to use to really be able to identify more quickly where in the state might need some extra support around this, so that we can support and respond when it comes to that. From that, I'm going to kick it over to Christy or to Martin to kind of talk about the development of the PCBA. But yeah.
So I'll start first. Donald, great question. I just wanted to also recommend attendance at the assessment and support plan working session. Wonderful questions related to the concerns around case management and the assessment process. And that working session, our next meeting on September 28th from 12:30 to 3 p.m., we go really in depth with stakeholder questions and concerns related to the Colorado single assessment and what that will look like in terms of training and actually going through the assessment itself. So I just want to say we do have that resource for stakeholders and we value your input. So I'm happy if you want to reach out to me to add you to the invite so you can bring up those concerns. And somebody who is a SME in that area, far more equipped to respond to your concerns, can absolutely talk you through kind of what the plan is and how we're trying to mitigate some of those concerns that have been brought up related to case managers conducting those assessments and ensuring that they're adequately conducting those assessments. So I apologize that I can't give you a better response on that question specifically. I know Adam touched on it. Related to the PCBA, and Martin can get more, he's far more detailed on this than I am, but just a brief overview with the PCBA is that the Colorado single assessment we will identify with stakeholders critical variables when we meet with stakeholders, and we're going to weigh those critical variables, and those weighted critical variables will help determine the budget tiers. So those critical variables will be directly tied to an individual's support needs, and then will translate into the PCBA budget tier. So we will work with stakeholders to identify those critical variables and how we're going to weigh those and make sure that that translates into a budget tier range that's meeting somebody's support needs. And again, if for some reason a member whose service needs and costs exceed their identified PCBA budget tier range, if we run into that, we will have an exceptions process that we are going to work on creating with stakeholders as well to make sure that that supports the member. We are trying to mitigate any negative impact and really learn from historical lessons learned and apply those to this new process. Martin, you might have a much more detailed response, but if you do want to supplement, otherwise, Donald, I hope that helped put your mind at ease. That's where we're moving in terms of the development of the PCBA.
Sure. I'll just add a little bit more, and that's that the critical variables that we identify, like you were talking about, are the variables that we think are most closely associated with the person's service needs. And those are the variables in the Colorado Single Assessment. And then as part of that process, we also do some math and look at historical data and authorizations and things like that to get an idea of how much each of those variables has an impact. So it's a process there of kind of bringing together the stakeholder feedback and what the data say and all of that.
Awesome. Thank you, Martin. Thank you. Thank you. Catherine, I believe your hand was up next, and then guys, we will circle back around to the comments in the thing. But Catherine, if go for it. Catherine, we can't hear you. Are you on mute?
There we go. Can you hear me now?
Yes, we can hear you now.
I have some good concerns about how we're using a language that may not be the same. And I put in my comments, when I hear person-centered planning, I hear a whole different thing than I think what we're going to get. And I would actually prefer you to call it something else if it's not going to be the true form of best practices of person-centered planning. I've been in this field for a long time. I don't know what you guys are talking about. So, what does person-centered planning mean, other than it's another process, another name to do the same process? And I totally agree with Donald. I think too many. I'm just having a hard time connecting these dots when we have. And I understand that you're overhauling the case management system, which I think probably can use it. I just don't, in my experience over the last 4 years working with case managers, I do not see a single case manager who understands person-centered planning in the way it was intended to be done. And, you know, I think we have to keep in mind that person-centered planning is about inclusion, which means it doesn't happen over a Zoom call. It doesn't happen just with the person. It happens with the family and the community. Right. Because, and it's gifts, talents, and abilities focused as well as needs. And I have yet to be in a person's planning session with my daughter where they focused on her gifts, talents, and abilities. Just haven't ever had that experience here in Colorado. And we had one really great case manager who we could kind of work with to kind of help her see that, so she could say, well, this is what you want. But in Donald's perspective, this train is moving really fast. And I think people with IDD and families who support people with IDD are not going to be able to keep up unless we really have an ability to bring them along. And I think this will cause a little bit of a panic for people. And I think that families are already stressed a great deal right now. And I think what we need to think this through a little bit on how we do it. I understand, and this goes back to a previous comment I had about customization and person-centeredness. We got to move the state, and I get that. And I get the data is really important, and I get all that. But you guys talk so fast that anybody who has a processing problem is going to have a hard time participating in this. So I don't know how to balance that out, but I just want to let you know that I think it could be a challenge for a lot of people, and especially if you are not an English speaking individual. English is your second or third language, not your primary language. And you know, I think we always have to look at, are we meeting the needs of our diverse community in Colorado when we roll these things out?
Right.
And can a person with IDD understand? And you know, at this level, this may be fine, but it can be an impact on them, and the families are going to freak out because in the data perspective, are you taking historical data on the person so that what their plan has been is going to continue to be their plan, with maybe they missed a few things, but the families are going to look at this, they're going to cut our services. Right. This is just a trick to cut our funding. So I'm just telling you.
No,
That's how
and
it's going to come out.
I totally hear you, Catherine, and I think that that's one of the reasons. Well, I know that that's one of the reasons why we want to roll this out starting now, even though we don't have it all figured out, is so that we can really start the conversation. And I think one of the big things that I'm really hearing that will help us in our conversation kind of going forward is if we can kind of come back to this, to the council, and not only just tell you guys kind of what other meetings are kind of happening, but I think, you know, maybe even next month we'll talk through, or it may not even be next month because we're still working through it, but kind of what that training process looks like for case management, so that we can kind of pull that into this conversation as well. Because yes, lots of huge amounts of concerns. And one thing that I really want to point out is not point out, but just mention too, is that the PCBA, or this person-centered budget algorithm, this new term that we're going to have to, you know, we're going to have to get comfortable with, you know.
What does this mean?
So remember, this always happens after the person-centered planning process happens. So we will train on both of that, you know, and the person-centered planning process is going to be used first. PCBA is going to be used to make sure that we caught everything correctly, including if, you know, this shows up and it's way over. It's like, okay, why? Do we miss something in the universal assessment? That's how some of this is also going to be used. But yes, we want to introduce this early so we can have these conversations. We'll continue to make sure you guys know when meetings are, and then we'll also continue to bring this information so you guys are kept aware. And before I jump anywhere, Christy, do you want to, or Martin, do you want to add any more? Eileen, I think maybe if you would.
While we're waiting, I just hope that you can address if Telligent is still going to be in the picture with all this too. If it's adding another layer of accountability or review on top of this, just want to throw that out there real quick. Okay.
You know, maybe I think, Catherine, I think you kind of created, and I'm pretty sure that with Bobby and Michelle, and I think Donald is in the queue here. I'm pretty sure we're gonna need to come back and follow up a little bit more on some of the training and different things like that. So we'll definitely make a point to do that. And then also the little message that I just got is really if the best place to go if you want to really be involved in the actual process of making these decisions and kind of working through what all of this is going to look like. It's really going to be with some of the case management side. And so we'll make sure that we know when those meetings are occurring, and we can also announce those as well. So cool. Okay, Michelle, I'm going to go with you next. I think your hand has been raised. Hopefully it's not tired at this point.
No, I'm not too tired. Thanks, Adam. So this is just going to kind of piggyback on some of the things that Catherine said, as well as Donald, and some of the things that Megan has said. So my concern, I'm bringing a perspective of, I own a case management agency, so I'm a case manager, but I'm also a parent of a child on a waiver. So I always look at things from both a personal and professional standpoint. Case management, or I don't know, I couldn't even just say case management. Medicaid waivers, long-term care is going through an exponential amount of changes in such a short period of time.
Yes.
And historically, I mean, there's always changes. You got to ebb and flow with things like that. But I don't think that I've ever seen this many significant changes in such a short period of time. And I know that all of the various different departments at HCPAF are trying to work together. So this is more of a suggestion, is our end goal is to make services more accessible for members, and to make the system run more smoothly and to have the least impact. I'm really concerned with all of these different changes, all of these different acronyms. Members are going to get lost. Even, I mean, as Catherine mentioned, members who have an IDD or a processing concern, but then from the children perspective, when you're talking about person-centered, I can tell you right now, everything the way it's listed for person-centered is not geared towards children. I've received direction from HICPUF that when I'm writing a person-centered care plan for a 6-month-old, that I should find out if they have a special blanket or toy that they like to take to the hospital with them. And that is not person-centered, but that 6-month-old is also not going to tell me, you know, they would really like to increase their independence in XYZ. So overall, my comment question is, how is the PCBA rollout going to coincide with what's already happening? And excuse what I'm about to say, but I gotta be blunt, the shit show that the CCM is right now and the trickle down effect that is happening. Case management agencies are dealing with all of the bugs that are trying to be worked out with the CCM, the pieces that are not working, to include the service plan. Public health emergency wind down, which has become a nightmare. We're going into case management redesign, which is going to be a logistical nightmare of transferring families here, there, and everywhere when they don't even know what's happening. And this Colorado single assessment, that's going to change everything for case management as well as for families. It's a new process. And it's my understanding that that has been pushed back because of the issues that have happened with CCM. So now you're talking about CFC, which sounds like it's far away, but it's really right around the corner with how quickly life keeps going. So
Right.
I mean, we could just throw out acronyms all gosh darn day. So
Oh, I know, you know.
CCM, the CMRD, the CSA, the PCBA, and all of these things, I am really concerned that is there going to be proper training for case management to be able to keep up? And you might be able to design, we're going to design this really great interactive PCBA training for case management. Well, really work with those other departments at HICPUF to make sure that that training aligns with all of the other training they're already doing for CSA, for CFC. And, you know, now they're going to be responsible for IHSS evaluations within CFC. I am really concerned that we are creating the perfect storm. So to kind of wrap up, my suggestion is really hoping that all of the various departments for the different programs at HICPUF are really coming together to see what does this really look like, boots on the ground for case management. It may look pretty on paper, but might not look so pretty in person.
Michelle, totally, I completely hear you. I can also say that from a department perspective, we have very similar concerns because yes, you are absolutely right. We are revamping the system, and it's not going to, it's just not going to work the same as it currently does. Our goal is to try to roll this out in phases so that we can kind of mitigate any major fall through. Now, does that guarantee anything? Absolutely not. The other side of this as well is that we really want to make sure that we're having these conversations, we're bringing them up early. I think the big thing that I'm hearing is that the council, the CFC Council specifically, wants to hear a little bit more about more of the rollout of how this is going to actually work from a case management perspective, what's going to look like from a family perspective, and those those different aspects. And I think that I love the beginning of this conversation. I think this is where we needed to start, but I cannot answer all of those questions today. So we will need to go back and grab that information so that we can bring it back to you next month.
And Adam, if I could, I just want to at least respond to the question related to when the PCBA is planned to be rolled out. So the PCBA is actually the very last phase of the CCM system, and it will not be, at this time, it will not be rolled out until January 1st for members with IDD, and until, January 1st of 2025 for members with IDD. And then it will be applied when CFC goes into effect. July 1st of 2025, I believe, is when it will apply to all other members. And then prior to that, we're going to have a year where we are piloting the PCBA in the background. It's not going to apply to any members at that time. We're just running it in the background so we can make sure that the outcomes are accurate. And then prior to that, Optimus will be collecting assessment data, live assessment data. Once the CSA goes live, they'll start collecting that data from the CSA to work with stakeholders to develop that PCBA. So sorry, I worked backwards. I probably should have done it in the other direction. So let me reiterate, but going in the correct direction. Once the CSA goes live, at that time, we will start collecting assessment data, real live information for member assessments for Optimus to work with us and through stakeholders on developing those critical variables for the PCBA and how that's going to translate into budget tiers. And then once we get to a good place with that, we're going to actually pilot in the background with members going through the CSA. However, they're not going to see the PCBA outcomes. We're going to look at it, make sure it's accurate, tweak anything we need to tweak to make sure that it aligns with their support needs and it would provide the appropriate amount of budget tier monies for them to receive those support needs. And then after that, January 1st, 2025, we're going to apply it to members with IDD due to the fact that the CIS is going to be retired December 31st, 2024. And then after that 6-month period, it will then it'll be rolled out at the same time as CFC for the other members. So we have quite a bit of time. I know it feels like it's right around the corner. I get that. I'm right in the midst of all of it with Optimus and the team at the department. So we do have a lot of work to do with stakeholders on making sure that we figure out those critical variables, make sure they're weighted correctly, and work with Optimus to develop a really sound algorithm to make sure that we are mitigating that negative impact on members. And of course, if we see any negative impacts during that pilot period, we are going to work with Optimus to improve the algorithm before it's ever rolled out officially. Martin, with Optimus, do you have anything to add, or did I cover that okay?
No, I think you've covered it quite well.
Awesome. Thank you, guys. And then Donald, before I call on you, one last thing that I want to reiterate, because I know, Michelle, you've asked me questions similar, or you've asked the council questions similar before, and I just want to really make sure that I also state this, because I haven't done it today, which is that we are about to, in the next couple of months, really start to actually engage with the case management side of this, and really starting to think through how CFC, how IHSS, how CDOS, how all of that is going to work within that process with the case managers. And so that is still part of the plan. What we really needed to be able to do is kind of figure this piece out, and then also make sure that we had all of our services and supports finalized before we can really work through that. So that is still on the docket. It's still part of the project plan. It's going to happen. And we'll update you guys and let you know kind of what's going on with that. But that is also part of it too. So Donald, before I go down some other rabbit hole, please.
Yeah, I just want to echo people's concerns about the case management. Big changes. You mentioned they're getting rid of the SCPs, community centered boards. I even have an understanding that they're going to, but yeah, so that's a really big concern, because that's how you determine your person-centered plan. And then also, I have a background in mechanical engineering and software engineering, and the idea of condensing a person down into a couple variables just kind of makes my skin crawl, because that's moving away from person-centered planning. And so it's even somebody straightforward. If you're going to try to define me by 4 variables, 5 variables, a dozen variables, I don't think that really is a representation of me as a person centered. It's more of a representation of me, putting me in a group, and that's kind of what we're currently doing. So my concern is we're trying to move away from something, but our check, the balance is going to be the same thing we're kind of doing right now. It's by putting people in a group based on how many ever variables you define. And my understanding of data and variables, that's not an easy thing to do. I don't know what the variables would be: diagnoses, you know, I don't know, abilities, I don't know what variables you would define, because a lot of those are qualitative and they're not quantitative. So if you're trying to take qualitative things like, you know, my quality of life and base it down into quantitative data, like how long do I stay up, for example, I don't know, some hard number. That's a really hard transition to make. And so I was really concerned if the check and balance is going to be based on a handful of data. And then if you get a complex case, you know, that the needs are complex, how are you, what are you going to do on your algorithm? Or, you know, it's a big word, but really it's just, you know, a number of factors that you are looking against. How is that going to, you know, include all this complex stuff? And how are you going to be confident that you're not just recreating these buckets that we're getting grouped into, and make sure that we focus on person-centered, or, you know, the individual?
Donald, thank you for that. And yes, I think that we share a lot of the same concerns, and I think that that's why the order of operation. I'm not saying this just as a way to dismiss the concern, because this concern is very, very, very real. And one of the ways that we've started to look at this is through that order of operation. The level of care, we have to have a level of care, and we have to have a needs assessment, and it's federal. So we have to have some of that stuff. When we're talking about the algorithm on the other side, that only happens after the person-centered planning process. We're not going to even talk about any kind of algorithm until after that, and it's another check. I'm saying all of this, and it feels like I'm diminishing your concerns, Donald, and I'm not really, I'm not trying to do that. I'm really trying to set it up so that you guys see the order of operations. So as we're engaged in this and we're going down this line, we can think about it through that process as well. Because yes, I think that again, I don't want to diminish those very, very real concerns. Christine Martin, do you want to add anything?
I'll just real quick. I understand and I appreciate the direction you're going. And, you know, maybe if, you know, you don't get any, maybe the success will be the pilot. If you don't get any kickback from if the person-centered plan never goes over the budget tier, then it's not a worry. If this is happening 80% of the time, then, you know, that's a big concern.
There's something wrong with that. Then, yeah.
So, you know, it depends on how big your bucket is, and, you know, but I'm just really concerned that we're going to get a lot of these budgets going over your tier, because it's meant to be a fiscal saving matter, and you know, you guys are in the business of saving money, and so this fiscal thing is a check and balance. And so if it never comes up, you're not doing it right, you know. So I'm just concerned that when this does come up, that you really want to make sure, and I understand that there will be an exception process, which, you know, you'll have to have, but I'm just concerned that we're getting away from person-centered if we're using the check and balance as a bucket.
Awesome. Thank you, Donald. Really appreciate it. And guys, we really appreciate this conversation, hearing these, especially because, you know, really this is the first time that we've brought this up in the council, and we started kind of talking through this. I think what we really have, and Christy, I'll kick it to you if you want to add anything.
Oh, yeah, I think reiterating that we hear the concerns, and we plan to take a really good close look at the PCBA during the pilot phase to ensure that the critical variables that we are using and how they're weighed are really capturing the support need in a way that the member does not have a negative impact. certainly there's going to be a margin of error, just like any algorithm. And Martin, I apologize if I'm not using the correct terminology, but there will always be some outliers that we're going to have to address through an exceptions process, which is why we are going to have it, to make sure that we are continuing to mitigate that negative impact if it does arise. And of course, we want to make sure that that's a very small number of people. If we notice during that pilot phase that we're seeing a large number of people falling outside of those budget tiers, we're going to adjust and work with Optimus and stakeholders to make sure that we look at those critical variables and how they're weighed. I also want to say that there are going to be a large number of critical variables. It's not just going to be a handful. The assessment itself, even though members will not answer this many questions, the assessment itself does expand to 1,500 questions or so. So of course, if somebody doesn't check a box for a support need, then it won't expand out to those additional supplemental questions. So they're not going to go through 1,500 questions. However, the CSA was created in such a comprehensive manner to make sure that we addressed all those factors of life as much as we possibly could. And I'm not the expert on how that was developed. That's HCBS strategies. If you attend the assessment support plan meeting, they can absolutely help answer your questions more in depth about the CSA itself. But however, we are going to continue to work on making sure those critical variables are comprehensive, that they are weighed appropriately, and they translate in such a way that a member's support needs are being addressed. And we will continue to look at that, not just after the pilot, but year after year. We're going to continue to look at the PCBA to make sure it's still working appropriately. And if we need to adjust it, we can do that. We have a plan with Optimus that they've helped work with us on to ensure that this is an ongoing effort, not just something that stops in 2025 once we implement. So I just hope that to some degree addresses your concerns, but I understand we have a lot of work left to do, and we welcome stakeholder feedback. We value it, and we really want you guys involved in that process to ensure that we're working in partnership on this plan.
Awesome. Thank you, Christy. And with that, guys, yes, I echo that. And what I'm going to do now is kind of pull us back to the CFC kind of side of this. And so what we're going to do is the conversation that we've had, as well as the questions that are in the chat, including Bobby. I just want to mention to you, Bobby, that like if I write an email and there's not at least 10 typos in it, then people don't believe it's coming from me. So no worries about typos. But we will gather all of this. We'll make sure that we collect the information and try to seek out as many answers as we can. And then we'll come back with some additional information next month, especially with some additional resources of where to go. But for right now, I'd really like to close this conversation and kind of pull it back into more of the CFC realm of things. So with that, next slide, please. Bobby, did you want to say something?
No.
Okay. All right. Cool. So, Christy, this really is yours. Your slide. Do you want to take it, or I think you've covered it a couple of times. But so just so everybody knows, we do have the assessment and support plan working group. They happen the next one is Thursday, September 28th from 12:30 to 3. Please reach out to Christy. Also, Lori Thompson is also another guru to reach out on. She apologizes she could not be here today. She had her big yearly vacation that she got to go on. So yeah. And Catherine, I will personally work on that question to make sure that that we're answering it from that person-centered lens of how are we going to support members and really understanding this as well. So, so with that, Christy, do you want to add anything really quick?
No, just wanted to remind everybody, if you could send me an email, that way I can, I don't own the invite for the assessment and support plan working sessions. That's Ryan, I believe. So I will be able to connect with Ryan and send her a list of stakeholders that would like to join. And I just want to express that I really appreciate everybody's feedback today. We consider all feedback. We find it very valuable. We work with stakeholders to ensure a comprehensive approach. You know, you guys bring up so many valuable points that we are keeping track of. And so if you have just a broader concern or questions related to the whole CCM system, the CSA, the assessment itself, support, person-centered support plan process, and that kind of thing, that is really the meeting where we are going to be diving deep into that. And that's not really my expertise. There's a whole group of people at the department with HCBS strategies that are working on that together. My focus is the PCBA. Of course, I have to learn everything about the assessment in order to make sure the PCBA is comprehensive and accurate in terms of support needs for a member. But when it comes to like the nitty gritty and like those concerns that you brought up today, I apologize if I haven't been able to address those adequately. So please attend that, email me your interest in that. I'll grab your email address and I'll get that information over to Ryan so we can add you to that meeting. And hopefully we can answer some of your questions more comprehensively during that meeting, and just really appreciate the feedback. So thank you.
Awesome. Thank you, Christine. Thank you. Next slide, please. Any final questions? Again, kind of back to CFC. Let us go and do some work. And to let you guys know too, we were, again, thank you for the questions, because without these questions, this really does help us work through issues and make sure that we're addressing things. And just because I always think of it as anytime I come to a meeting where I'm not able, as part of HICPUF, where I'm not able to answer all the questions, I almost feel those are some of my favorite meetings, because it gives us something to go and really work through, and it kind of shows that, man, we have some more pieces of this that we need to talk and we need to discuss kind of internally. So thank you guys so much for those questions. So next slide, please. All right, we'll just do open forum. Again, this can be on anything. We cap it at 2 minutes. Anybody, please just raise your hand if you'd like to be part of the open forum. I think we always kind of try to shoot for having open conversations throughout the whole thing. So a lot of times we don't have open forum. All right, next slide, please. All right, guys, any other questions specifically about CFC? Anything you really want to or need us to follow up on today before the next council meeting? Do not hesitate to email us. It's hicpuff_cfc@state.co.us. You can also give me a call. It's only going to go to a voicemail. So when you call this phone number, it goes to my voicemail. But that is 303-866-5472. I'm going to tell you guys, if you want to get a hold of me, it's easier to email me if you have that option. I check my voicemail about 2 or 3 times a week. And then if you want accommodations, John Barry really is the best to reach out to. And his email is included at the bottom. Next slide, please. So our next council meeting is next month. It's Wednesday, October 4th, from 10 a.m. to 11. And we're going to be talking about web rule for MSB, kind of giving some updates there. And then really kind of coming back and kind of going over some of the answers that we have found from this meeting, as well as letting you guys know which ones we still need more time to work on. So again, guys, this has been a great meeting. Thank you, thank you, thank you. So next slide, please. And that slide just said what I said. So thank you, everybody. We really appreciate you guys joining us today. This has been an incredible conversation. And we will talk to everybody next month.